This is the Kron 4 Morning News.
Hello, everybody. Welcome back to our second live hour of Kron 4 News Weekend. Speaking of health care coverage, a Bay Area surgeon has a bone to pick with insurance companies and how they handle doctors and patients. We'll talk to him coming up. Well, in these tough economic times, millions of Americans are feeling the pressure of the skyrocketing cost of health care.
But for insurance companies, the advantage is on their side, and many of those companies know it, and they show it by sometimes denying patient coverage or delaying treatment.
Joining us this morning is San Francisco spinal surgeon Dr. Kenneth Light, who says it's not only the patients who are frustrated, but the medical practitioner as well. Welcome. Good to have you
Good
here.
morning. Thank you very much for having me.
Well, it seems to me that more and more practitioners are very frustrated with this system. Have you finally stepped on board with President Obama and say something's got to change?
I think something does have to change. And what to do about this is very complicated. Healthcare dollars have to be allocated more toward patient care and less toward the administration of healthcare.
Give us some examples in your practice that you've come up with dealing with this wall of bureaucracy that has blocked healthcare or impeded healthcare.
Well, as you probably know, surgery is not a perfect science. Surgery depends on the patient coming to the doctor, having an examination, discussing various options, and then embarking on a course of treatment. And right now, the way many cases are decided in terms of surgery is that there's a piece of paper that's sent to a physician who happens to have a desk in the state of Texas, who looks at this piece of paper and then makes the decision what type of operation the patient should have. And medicine just doesn't work that way. Surgery is something that's difficult. It works on a case-by-case basis. The surgeon has to discuss the treatment with the patient. The surgeon has to be able to review and see all of the tests and in order to make a proper decision. And right now, all of the basic principles of medical practice are being set aside.
So are you hearing a growing rebellion, if you will, amongst other practitioners? Is there talk about doing something or getting engaged with President Obama's attempt to reform healthcare?
Unfortunately, the doctors have taken a more passive role, and they have followed the lead of insurance companies. And I would like doctors to take a more active role.
In what way?
I think that doctors have to be included in the administration of health care. And right now, doctors are excluded. Doctors now are considered as commodities, as workers in the healthcare system. They're not involved in making the policies of healthcare. And I think that's one of our big problems right now.
So to take that a step further, if you had the president's ear, what would you suggest to him?
I would like to see doctors involved in the decision-making policies. I would like to see doctors on the boards of insurance companies. I would like to see doctors, I would like to see less business in the administration of medicine and more medicine involved. Many of the decisions, medicine is a huge business in this country right now, and the medical dollars are in a pie, and the business is cutting out a big piece of the pie. Those dollars should be allocated toward patient care and should be given to taking care of patients, not segmented out because medicine can make money. That is one of the big problems in medicine today.
Well, one of the things that the president was discussing yesterday, or the outcome of the healthcare summit, was that the medical costs have to be cut because it's hurting everybody. Do you think doctors are willing to accept a formula where they're perhaps they get less pay if everything else is equal?
I think so, but right now doctors' pay is not the primary cost in medicine. The cost of medicine is linked to many things. It's linked to the price of gasoline. It's linked to the price that hospitals have to pay their workers. It's a very complicated formula, and I agree, it is very high. But everything is high right now. Everything is expensive.
If the status quo remains, in your mind, what is the future of healthcare in this country?
I think the future of healthcare in this country still is very bright. We have some of the smartest people in medicine in this country. And what I think we have to do is, again, make it less of a business. We have to take the premiums that people pay to insurance companies and give them back to the patients, not provide bonuses for people who administrate insurance companies.
You know, it's like kind of ironic. The president is talking about reversing the stem cell decision made by President Bush. So there's so much bright, new, cutting-edge medicine that's out there, and yet it's going to add more costs and more costs and more costs to healthcare if something isn't done. Unfortunately,
that's true. I mean, if you want to have progress, if you want to have the brightest people working on these products, and on this technology, they will have to be paid just like any other thing we manufacture in this country. But it's worthwhile. It's a worthwhile endeavor. I mean, if we had a cure for cancer, the amount we spend on that probably would be money well spent, much better than possibly doing something frivolous.
Dr. Kenneth Light, thank you for joining us. I want to let people know about the website that you have, drkennethlight.com. Thank you for joining us.
Thank you very much for having me.
Appreciate it.